Now, in the third section, we will talk about the diagnosis and treatment of tumors of middle ear and mastoid. In this, we will talk about different investigations that can be performed for the diagnosis of tumors of mastoid and middle ear. What are the different treatments available for the tumors of the middle ear and mastoid, and if the surgery is performed, what are the different approaches to perform the surgery for the tumors. Diagnosis is performed to find out the extent of the tumor, how bad is the tumor spread, and how what's the extent of the tumor. Associated glomus tumors present or not. Serum level of catecholamines or their breakdown products in the urine like vinyl, mandelic acid, and metanephrines. These are the byproducts of catecholamines. Catecholamines are produced by the tumor, and if their levels are increased in the serum and the level of the byproducts of catecholamines, that can be measured. So, diagnosis based on finding the extent of the tumor, how bad the tumor is, what's the extent of the spread, localized, distant, metastasized already, staging is important. And then if there are any associated glomus tumors, and what's the level of catecholamines. Investigations, different investigations performed for the diagnosis. CT scan of the head is performed. MRI, magnetic resonance imaging, again combined. It can be CT or MRI, or both CT scan and MRI can be performed. 4-vessel angiography is performed, and then angiography mainly to find out if there is any blockage in the blood vessels, how the circulation, or if it's affected or not. Brain perfusion and flow studies. Brain perfusion is important to find out if the blood flow to the brain is affected by the tumor, or what's the flow studies. So this is again an important test to be performed. Then embolization and biopsy. If there is any embolization, and biopsy is performed for the staging of the tumor, to diagnose what type of tumor is it, and what's the extent of the tumor, and what's the stage of the tumor. Treatment is surgical removal of the tumor, radiation, embolization, combination of techniques. So combination can be performed, or it's the surgical removal and radiation, embolization, or can be combination treatment. Surgical approaches to the glomus tumor. The surgical approaches can be transcanal approach through the canal, suited for limited glomus tympanicum tumor. Localized glomus tympanicum, which is present from, which arise from the bulb of the tympanic bulb. So this is, if it's localized, the approach should be transcanal through the canal. Hypotympanic approach, below the tympanic approach. Hypo means below. For tumors limited to promontory with extension to hypotympanum. Extended facial recess approach. This is for the tumors for Glomus Tympanicum extending into mastoid. Mastoid neck approach for Glomus Jugulare tumors not extending to internal carotid artery, posterior cranial fossa or neck. Infratemporal fossa approach of fish when we have large Glomus Jugulare tumors. And then we have transcondylar approach is for tumors extending towards foramen magnum. Radiation and embolization is performed along with the surgery. So there are 6 approaches to the surgical approaches for the removal of the glomus tumor, and these approaches depend on the location of the tumor and extent of the spread of the tumor, how far it is extended, then decided what approach should be used. So transcanal hypotympanic extended facial approach, mastoid neck approach, infratemporal fossa approach, and then we have transcondylar approach. So that was all about the investigation and surgical approaches for the treatment of the glomus tumor. Thank you for watching sqadia.com.